When I wake up in the morning, all I need to hear is praise and wonder.
When I wanna hear the best in the A,
All I need to hear is praise and wonder. When I wake up in the morning, all I need to hear is praise and wonder.
and I just can't finish my day.
Without my praise and wonder.
Dr. Jimerson, how are you?
I'm good. How are you doing?
I am doing good. You know what? I was wondering why every time I see you, you got a big smile on your face. Now I understand why.
He likes his profession.
I think he does.
I love what I do.
I
bet
agree.
you
You know
do.
what? We love what we do, so we are not
We
hating on that.
understand.
We understand. Ladies and gentlemen, he is here, Atlanta's plastic surgeon, in the building. Where do we start, Wanda?
I don't know. As soon as he walked in, I said, "Did you bring the injections? Pump it up."
Well, we're talking this morning. Have you ever thought about getting butt implants? Or in some people, in some cases, which is really, don't really do it, getting butt shots. Now, what's the difference? Explain the difference for us.
Okay, so there's two surgical procedures that you can get. You can get either butt implants or you can get fat grafting to the butt. And that's where, so butt implants, where we take a silicone implant and we'll insert it between the muscles. And fat grafting to the butt is where we'll take fat from different areas of your body, like your stomach or your flanks or your lower back, and then we'll make your waist smaller, and then we make your butt bigger, so we give you a nice shape, overall shape. The butt shots is not a surgical procedure. That's performed by people on the black market, and
Yeah, because we heard
they used to
stories
go to
they're putting,
people's houses.
and they're putting Fix-A-Flat and all kinds of
Yes.
stuff in girls'
scary.
butts.
Yeah, that's.
Oh my God!
I would not recommend that, but that.
He's on a black market.
Well, because they're performed by non-doctors.
Wow.
Now the thing is, do you call yours a Brazilian butt lift?
Yeah, I call it. I mean, the popular term is Brazilian butt lift.
Okay.
But fat grafting to the butt is just the generic name.
And I would agree with saying the Brazilian butt lift, because when we were there, like, all the butts look the same.
Yeah.
And then they do something with their shorts to make it look like the perfect little apple.
Say that again.
The perfect little apple.
Amen.
Yes. They do.
So you have some guests with you. We have Melissa, and we also have Michelle. Hi, ladies. How are you?
Good. How are you?
Okay.
Wow.
And Wanda and I saw your before and after pictures,
Yes.
and all I could say is, wow.
Okay, I
Looks
have
good.
questions.
Go ahead, Wanda. Go
Okay,
ahead.
Melissa. So what was this process like? Like, did you say, okay, my clothes aren't fitting right? Or were men looking at you saying, oh, my God, you need more butt? Like, what?
It's the clothes.
The clothes fitting right?
Yeah.
So
It's hard.
Dresses, skirts, it's not cute.
Not cute. So you were like totally flat, nothing back there.
Right.
And you wanted a nice little,
Can you stand up for me once again? I tried to take a peek while you walked in. And
you want to see it? Wow.
okay. All right.
Why is she turning around and really letting us look at it?
Okay. Okay. Like you could almost put a glass up there that won't fall.
Wow. So how was the procedure? I mean, how long did it take? Was it weeks? Was it a day? Tell me something, girl.
The procedure itself, I think the day of, I think it takes about 4 hours. I don't remember any of that.
Okay, so you're down under.
You're down under, good. And the healing process, I think it took me about a month to look myself again, maybe 3 to 4 weeks.
Was it painful when you were done with the procedure that, you're healing?
It was painful,
Wow.
but it wasn't that bad. I've had 3 C-sections.
I'm about to say, okay.
So,
Yeah.
Yeah,
So
okay.
it's-
if you can do that, you can do anything.
Yeah,
so
girl.
that
I
was
did
like,
that twice.
okay, just didn't sit on my rear end,
You couldn't sit on it?
Oh, no.
So you have to lay on your stomach girl. So you can't sit down for how long?
2 weeks.
2 weeks.
2 weeks.
Are you
So
serious?
you're like in the
bed.
house.
You're in the house, yeah.
In the bed.
You don't leave
So
the house.
just take vacation and just lay down and
Wow.
Get a babysitter.
Wow.
That's not too bad, though.
It's
2
not.
weeks.
It's not.
2 weeks
It
is not
went
bad.
by so fast.
How many of these do you do, Dr. Jimerson?
I usually do about 2 to 3 a day, and I operate 4 to 5 days a week.
Wow. Wanda Smith.
I know. So do you see a difference? I mean, with people looking at it, now you're wearing tighter clothes because your dress
Yeah.
today is definitely, we have to look right there as soon as you get up and
Wow.
like focused on it.
Yeah, you definitely get a lot more attention.
Wow.
And in the studio also, Melissa, tell us what was your experience with it?
Show.
That's
Michelle, sorry, yes,
Yeah.
Michelle.
My experience was a little bit different than Melissa's. I did experience pain, but my pain was generally in the areas of the liposuctioning. My butt never bothered me. It took me about 6 to 8 weeks to feel normal.
And what was her surgery? Tell us about that.
So she had liposuction of her abdomen, her love handle area, and her lower back area, and she actually had to gain weight. You know, a lot of people have to gain weight in order because they need enough fat to put in the butt because some of it resorbs. So I always want to put more than needed, and so she had to gain weight, and I'm not sure exactly what she did to gain weight. I think probably Ensure and some and then so I liposuction all those areas, and then fat grafted it.
So
to
you
the
brought
butt.
in the waist and whatnot, and then
Yeah. So I'm not just fat grafting the butt. I'm creating a look.
Right,
See, when
right.
people come to me, they don't just want.
So you're like an artist. You're an artist.
Well,
My
I guess.
man.
Wow.
It's like a sculptor. You know, it's like
Absolutely. Say that.
so. Yeah. So, you know, so I mean, I don't.
Can
call
you
my-
help our producer, Patricia?
Let me see.
I'm just playing. Because she on the petite side.
She's So she had to
Do
gain
you
weight.
do you do
had
the
to gain
petite
weight.
women as well?
Yes, I do. Now, if she couldn't gain weight, then she'd be more of a candidate for butt implants.
Okay.
But you know, if she gained weight, which a lot of people can do, then yeah.
Do you ever have instances where women say, "Can you take some out?" Like my butt is too big.
I have never had that happen.
So you're like you're perfect, huh? I'm gonna make it this way, and I'm
Wow.
gonna pump it up over there. So
Yeah.
you're really wow. Can you tell? Are there any marks, ladies?
There is some marks on the side of you,
Right.
but
Very
they
small.
go away.
It's like the tip of your pinky.
Oh, really?
It's just where he inserted the fat. So
So I asked, during the break, how much does this procedure cost? Because I know everybody's like, how much does it cost?
It's $9,300 if you finance it. If you pay in cash, we do offer a $500 discount, so it'll be $8,800.
Okay.
All right.
All right.
Now, sometimes people combine other procedures with it. Let me make it clear: butt shots. That's completely different procedure than fat grafting to the butt.
Okay.
Fat grafting to the butt is performed by a plastic surgeon, whereas butt shots are performed by some person out in the community that's not medical. And and so what you're doing is, you don't know what you're getting because they don't have access to medical grade stuff. So I mean, you're getting Fix-A-Flat or silicone. I mean, stuff you could buy at the local hardware store.
Not
and,
cool.
And they're getting this injected in their butt, and I see those patients in my office.
Wow.
So they come to after they have it done.
That's like
and
poison.
It's all screwed up. They want you to fix
Right,
it.
they want me to fix it, and a lot of times you can't fix it. I mean, that is real lumpy, hard. The procedures that we do, I mean, your butt's soft. It feels just like
a regular butt.
Yeah, I mean, and very natural.
Wow.
Okay, so Dr. Jimerson, if somebody comes to your office and they say, I want this done, how long is it? Do you go in and you start drawing it up? Like, because I've seen, like, on, Lifetime, where they take a marker and they start drawing on the body and deciding where they're going to cut. And
A Sharpie.
Is it more computerized now? Is it more computer? I'm saying it's real. I'm a man, so I'm asking questions.
To be honest with you, it's exactly the same way you saw in Lifetime. I mean, we go in with the Sharpie and we mark exactly which areas we're going to liposuction or which areas we're going to excise from. So I always tell people that if someone's planning on having any procedure, especially the fat graft and butt procedure, you want to go to someone who knows what a nice butt is supposed to look like.
Okay.
Because it's hard to describe, and different people will think different things look nice.
Right.
So you really need to go to someone that has your vision or understands what your vision is, because a lot of times you can't women have a hard time explaining
Right.
exactly what they want.
And doctor, if people want to get a new butt, how should they get in contact with you?
You can reach me. My phone number is 678-205-8400, and our website is advancedplasticsurgerysolutions.com, and we have a Twitter, Dr. Jimerson. That's Jimerson.
So, ladies, get a sponsor. We don't have anybody to pay for it. There's a truck stop right over there off of
Wanda Smith.
like you got to get the truckers as they come in. What? Please.
Oh.
Rain on wonder.